Well, I'm with David Ashford, Minister for Health and Social Care, and we're in his office. You're running around doing a lot of things now back in place. When we came in here, we had to wear a mask just for things like that. Is this where we're at to with government now? Just precautionary measures?
Yeah, we're in the mitigation phase now, Paul, so the messages are clear that where people are in enclosed, unventilated spaces wherever possible, then they should try and take precautions such as mask wearing, and obviously, if people can social distance, then they should continue to do so. But obviously we recognise that there's many businesses and others that can't operate under those circumstances.
Well, here we are on Monday. We've got to date this. What time is it on that clock?
Don't use my clock,
no,
it's gone,
right.
The time's gone. It's just gone 12 o'clock.
Are you going to do a press conference tonight?
So tonight there will be a press conference just to explain some of the border changes that are coming in. So nothing for people to get concerned about, or certainly not at 12 o'clock anyway.
Sets the hairs running though. People start running out and buying food.
Yeah, there's no need for anyone to loot Tesco's or anything else. It is purely down to border changes and just explaining to people, because people want to know what potentially will be coming in with level 3 on the 1st of May.
And that's, I know you're not going to tell me anything before the big reveal, but things are looking okay, are they?
Things are looking okay at the moment. As always, I'm going to use the caveat that things can change, but certainly at the moment things are looking good, and myself and the Chief Minister at the press conference just want to run through some of the changes and what they will actually mean for people.
Weekend looked pretty okay. You must be every day looking at these and expecting, well, not expecting, but not wanting to see what we had last time. Are we on the right trajectory, do you think? We
are at the moment, but we do need to be still very, very cautious. We had those unexplained cases, still don't know the origin of them.
Still don't.
And we may never, because if they've come, as I've said, from an asymptomatic line, we will never truly be able to actually trace it back the whole way. So we do still need to be cautious. It's very positive, though, in the way it's looking. But I think the Director of Public Health has used the example before about a moorland peat fire and something burning underneath. So we just have to be careful from time to time because things will crop up.
I was trying to push you about what I'd heard about that case, and it seemed logical what I'd heard, but you don't think it helps to put people's minds at rest almost, to try and at least indicate. The last one was about CPAC, wasn't it? So this one has another potential obvious thing, because if it was a key worker, which I understood it might have been, just seeing if you're going to give you any indication.
Yeah, we've got to be very careful because we've got to balance the person's right to privacy alongside getting as much information out to the public as possible.
But what you said last time.
The one thing I can make absolutely clear, because I have seen going around on social media that is completely incorrect, is that there was no travel involved in these cases. That's why they're from an unknown source.
Oh, there was no travel?
There was no travel involved.
Oh, that blows my mind.
There was no travel involved. That's why we're saying it's an unknown source. If there was travel involved, it wouldn't be from an unknown source, because they've potentially contracted it while travelling. And that's why, as I said at the last press conference, the two individuals have done nothing wrong. No. They've come forward, presented with symptoms, been tested positive, but they haven't been anywhere. And that's precisely why precisely why there is an issue.
So it's kind of weird because you say social media, this is what's happening. These stories just get out of hand. Don't you have to therefore put some context to it? Just by saying that hasn't actually done anything to name anybody. In fact, it's probably taken a lot of pressure off the people that I've heard about. And you go, oh, okay.
Well, to be fair, I thought we made it clear that there wasn't any travel involved, because we said it was from an unknown source. It was people on island within the community.
Yeah.
So we actually said it was community cases, effectively. So that suggests it's not a traveller, because we actually record on the figures.
So that's much more worrying, isn't it, then? That's much more worrying.
Well, it is, and that's why, like we say, it's an unknown case and we need to be cautious.
Mm. So, we were all told to be in bigger, roomier areas, ventilation. How's that going to play out? For instance, Tynwald, how are you going to literally do that when you're in a room that hasn't got much ventilation? Do you have to follow your own guidelines?
Well, yeah. What we said is where possible. So there's things you can do to ventilate a room. So let's take the Tynwald chamber for example, which you know well because you've come in and filmed us many times. Yeah. You've got the two big doors by the side of where you sit in the press gallery. They can be left open. You've got the side door that comes into the chamber as well. So in terms of ventilation, that should be left open. It's a high ceilinged room. So the air circulates up in towards the press gallery, and even as the air that circulates to the back, there's a door behind Legislative Council that can be left open, and there's also the grid at the back there as well.
But in the longer term, I'm not just obviously just Tynwald, but is that a view you're going to have to go back and revisit various government buildings, if nothing else?
I think everyone in society is going to have to. We have to, some buildings let's be honest, we've got to be honest, you can't really do much about ventilation because they're old-fashioned buildings and all the rest. But I think all of us as a society, longer term, are going to have to look around ventilation. I was having an interesting chat with a Tynwald colleague who was mentioning about, the sort of culture around buildings over the last 20, 30 years has been about creating sort of boxes where you retain heat within the building, and not ventilating. We've been going the other way. So, I think maybe it's a bit of a culture change that will have to go through the whole of society going forward.
And should people be worried about going to, the government owns a cinema, for instance, and that's not particularly a big room. And there's other places you could be going to, entertainment-wise. How nervous should people be?
Well, people need to take a balance of risk here. And it's about, government is, and this is where I think a lot of people will be nervous. They've got quite used over the last 12, 13 months to government telling people what to do, what they should do, what they shouldn't do. This is the nervous phase now as government steps back out of people's lives and says you have to make the association risk of what's right for you. So if you don't feel comfortable going into a cinema with crowds of people, then basically don't do it. If you do feel comfortable with that, then the option is there for you to do so. Same with the Gaiety Theatre performances, etc. People have got to decide what's right for them in their individual circumstances. And you may well see people sat within the theatre complexes, within the cinemas, wearing masks and so on. People will make their own decisions about what's right.
I think I can just imagine going to something like that and you're fine, everything's happy, then you hear someone going and immediately you do go, uh-oh. Because it could be anything, of course, can't it? But we are now so much more conscious of anybody like that making some coughing noises.
Yeah, people are self-conscious, and that's natural. But like I say, we need to put power back into people's hands. That's the point of the mitigation phase. Because we've got to remember why we went through an elimination phase and why we put society through all these lockdowns. And it is difficult now to think back 12 months. It's been a roller coaster for most people, I think. But the purposes of the lockdowns were very specific. So last year, it was to stop it running rampant through the population and causing the serious illness and death and overwhelming the health services that we'd seen in other countries such as Italy, that was starting in the UK as well, and even had happened in some of the Asian countries. So that was the purpose of the first lockdown, where we tried to buy time. The vaccine came along. The lockdown in January, we'd only just started our vaccine programme, so it was important that we had those mitigations in place again and that lockdown in place. And in February, we were in the process of vaccinating the vulnerable. So it was important we had protections around the vaccine programme, so we didn't do anything that could have caused a widespread outbreak in those vulnerable people while they were in the process of being vaccinated. So there were very specific purposes to the lockdowns. We've now moved on from that, and now we have given those vulnerable people the protection from the first dose. The second doses are underway. And that means we can now move on as a society, and we've got more chance of moving into the mitigation phase.
Well, let's have an update on vaccines and how we're doing. Are we still in this? I keep asking you each week. Are we still in that dip on the supply, or are we getting back up?
Yeah, no, we are. The dip is to the end of this month, so that comes this week. Hopefully from the end of this week, we will be going up. The important thing I would say is anyone 18 years and over is to get on and register for your vaccine, because from the 10th of May, we need to start turning our supply towards people's second doses. So there will be limited supply available for first doses after that date. So it is important that people, if they still haven't received a vaccine, they go online or ring 111 and register. That's anyone 18 years and above, so that they can actually get their vaccination at the earliest opportunity, because we have to deliver those second doses within the 12 weeks that's medically specified for people. So that means our supply must turn to those second doses for the individuals who've had the first.
So the dates we've got on our cards will be honoured as such, will they?
Yes. Yeah, the date you have on your cards is the date for your second dose.
But we all wait for another bit of communication, don't we, before it's confirmed? We don't just turn up. We get more. We hear something more, don't we?
Well, they should have booked your second dose at the same and the
Right.
appointment at the same time. I think you better check it, Paul.
Yes.
It should be on there, and it should be booked at the same time.
Right.
Yeah. I'm not sure if you get a reminder email or not. I'll be perfectly honest with the second one, but it should all be booked, and the people should know when their second dose is.
So you've got to keep a fair amount on those stocks, which is obviously upset some people because they think we should be getting out as quick as possible.
Yeah, but we have done exceptionally well with the vaccine programme, and the staff have been absolutely amazing across the HSC in rolling this out. We are approaching very shortly now 2/3 of the population having had a first dose. We've delivered over 70,000 doses. So we're getting there very well, and we're over 70% of the entire adult population now, heading towards 75%.
This is an old question, but it's relevant because the UK's been talking about a lot, about people who work in the healthcare system. Will it become mandatory at some point in their contracts to be vaccinated?
That's always a thorny issue. There is, and I believe there is in some circumstances certain vaccinations that healthcare workers already have to have. I think we're a long way off that, to be perfectly honest, at the moment. I know it's been talked about in the UK, but there would have to be negotiations with all the unions, and they would be involved, and we would wait and see how that went. I'll be absolutely clear, there is nothing that the Isle of Man is going to break suit with what's happening in the NHS wider across in the UK. We're not going to be rushing forward and saying we insist. We've had a much higher take-up amongst health and social care staff than they have in the UK. In fact, I believe amongst healthcare, certainly nursing home workers within the UK, over in the UK, it's only about 75% that have taken up the vaccine, and over here it's nearly 100%.
You were saying, chatting with the other Crown dependencies, what's Jersey? Why are they so upset with us? You've seen that we're on the red list, have you? What's going on?
Well, I know someone who's communicated with Jersey, and I believe that's an error. And they've had a communication back from Jersey saying that the island will be added to the green list. I think it was an issue with the calculation. So that might already have been done, because they have a calculation obviously in the background around rates which decides where you are. So no, I don't think it's Jersey being upset. From what I can gather, it's a public health miscalculation.
Because it was quite odd. I mean, only Southern Ireland and the Isle of Man, it seemed almost, was the red ones. Talking about the Crown dependencies, everything seems to be following in line. To some degree, you kind of see what's going on there. They're ahead of us. Do you agree with that? Guernsey particularly is ahead slightly, a few weeks' time. I mean, they're opening up and all that stuff.
In terms of opening up, they are. We're taking a cautious approach, and I think we're taking the right approach in that sense. We're ahead in the vaccination programme, but I think we've got to remember that the northwest of England was very badly hit. With the last bout of COVID-19 in the UK, the last wave. So we've got to think where we are geographically as well, and where a lot of our travel comes from. But all of the Crown dependencies are on the same trajectory. But the important thing to mention as well is, of course, in Guernsey and Jersey's exit plans, the dates are the earliest of. So it doesn't necessarily mean that's going to happen on that date. It means that's the earliest date that those things will happen. But we all will find that we are all on the same trajectory unless something radically changes.
Well, in part two, I've got a lot of questions about dates. I mean, we're probably going over old ground, but is that now what your mailbox is sort of concentrating on? People saying keep it shut, keep it open, get it done faster, slower, the usual thing.
I mean, it's a mix. I mean, out there's people who are exceptionally concerned, and it's quite right for them to be concerned about the speed of this. They think we're going too fast. There's another side that thinks we're going too slow and we should open up now. And then there's the people in the middle who aren't really sure whether it's the right approach, the wrong approach.
Well, don't think we all got used to the government saying do this and you jump, that's height. And suddenly it appeared almost like overnight, well, it's up to you now, boys and girls, it's your call.
And that's the thing, when you move from elimination to mitigation, there isn't really an in-between stage, because elimination, you are, whatever it is, you are looking to stamp on it, you are trying to stop any cases occurring. Mitigation is accepting that you will have some transmission, and it's how you mitigate that transmission, as the name suggests.
So, I know you're not going to answer this, but you've got the date at the end of June as a potential that we have everything back to normal. Nothing to alter that opinion. I'm trying to guess something out of you before you're going to talk to the nation at 4 o'clock today. But
yeah, we won't be discussing the June date at all this afternoon. Nothing has changed. It is purely, this afternoon's is purely around potential changes around isolation on Ireland and border, and the border changes that are coming in. Potentially at the weekend, where we want to give some clarity to the public, because we know there's a lot of people clambering to know what some of the detail around that is. But at the moment it's going to be very high level messaging, just to let people know the direction of travel.
And I think I'd probably ask you some of the questions about when these cruise lines come in, if they come in at all. Do you think there is potential that that's the sort of testing the the waters almost, the puns with boats. But, just they have a little bubble, they go to the Manx Museum in one go, they look at the wheel, I don't know.
Well, we'd have to look at that nearer the time. No work hasn't been done around that. As I said last year, when these same questions came about EasyJet and the fact they'd released a timetable, Isle of Man government border policy is not dictated by the airlines, it's not dictated by cruises, it's not dictated by boats, it's dictated by what we believe is the right approach for the island. So I know speculatively there's certain cruises that have said they will be stopping off here. There's flights even that some people have said will be able to come in. That will obviously depend on what we do. Our border policy is not driven by private companies. It is driven by the needs of the Isle of Man.
But supposing the 28th of June and we get there, that is a day that people can get back their lives. Is that how I read it?
Yeah, it's back to
you go on the boat,
normal.
Come back,
yeah,
just get off it and go home.
Yes. Yeah,
that would records of people or things like that.
So that would obviously there'd be passenger manifests in all likelihood, but that would be the way forward. I mean, I know this scares an awful lot of people, particularly with what they've seen around the world and everything happening, but we have to now start moving towards learning to live with COVID. We are doing what we can with the vaccination programme. Like I say, we have to go back to that early messaging. This was about protecting the health service, preventing it from being overwhelmed. And now we've got a lot of the protective measures in place. It's taken a long while to get here, but we have got the protective measures in place. We do now, as a society, need to start returning to some form of normality.
Just to finish, I mean, lessons learned, if the worst came to the worst, you just suddenly get a big outbreak, you can slam on the anchors ASAP, I mean, much quicker than before. Right?
Yeah, we can, and also, but again, we need to be careful with the messaging here about what we mean by outbreak. Yeah. It's not necessarily case numbers that would drive that. So, for instance, you could have an outbreak of 1,000 cases on the island, but if all those 1,000 are well, then that isn't so much an issue. If you had 20 cases that all required hospitalisation and treatment, then that could be an issue because you're seeing impact on the health service. So again, and I've got to get into this culture shift as well because you know how much I love data, Paul. We've joked about it numerous times. And it's fascinating to look at case numbers, active cases and all that. But we need to have a culture shift now. It's not around active cases. It's not around the number of cases. It's around what those cases represent. And do they represent a threat to the society as a whole? Do they represent a threat to the hospital and the health service?
And at that date, presumably the grandstand testing stops completely. I mean, everything just goes to normal. But people are still going to be worried if they catch the sniffles or something like that.
Well, there would still be surveillance testing likely to be in place. Whether we'd keep the entire grandstand testing facility is another matter because you can't keep that forevermore. But we'd certainly look to still do surveillance testing. So we're not saying there would be absolutely no testing.
So just to wrap it up, you're a cautious man. You've always said baby steps. Oh, just hit the bingo button there, haven't we? How are you feeling today? As of course at the time of recording and everything can change.
Yeah. I mean, I'm comfortable with the approach. I've agreed to the approach the whole way along. I understand people's fears as well, and particularly those who may have vulnerable relatives or vulnerable close family, including children. So I can understand those fears, but like I say, we are taking a cautious approach. We need to be very clear dates, which we're going to probably come on to very shortly. Dates are not set in stone. So, if things did change, then the dates can change.
And it's about people being responsible here on this. Everything.
It is. It's
thinking, washing, space, all those things that we keep hearing about.
And if people don't feel comfortable doing something, then don't do it, basically. And like I say, people taking their own choices, and people will continue. There was some people who feel their responsibility is to carry on social distancing, to carry on wearing masks. And as a society, we have to choose, what we believe is right for us. The government will still issue guidance and actually say what we believe. So we spoke about ventilation, which is absolutely crucial, ensuring we've got the ventilation in place for rooms and buildings, and also mask wearing in certain circumstances. But the choice is the individual's.